Hi everyone, thanks very much for joining this session. What I wanted to talk to you a little bit about today is what we have seen over the course of the last 12 months with the global pandemic in terms of patient portals being leveraged to reduce administration time and patient contact, and I guess their role generally in virtual care. Before we jump into that though, I just wanted to tell you a little bit about myself. My name is Nicole Allan. I'm the Engage in Virtual Care Product Director at Orion Health. What this means is that I look after all of our consumer engagement products, and that includes but isn't limited to our patient portal solution and our remote patient monitoring solution. I've got over 20 years of experience in healthcare IT, the last 5 years of which have been spent at Orion Health. I was originally brought in as a solution architect, and then I was moved into the Engage product specialist role, which I've been doing for about the last 2 years now. Prior to that, I was a solution stroke technical architect across Scottish health boards and actually some of the NHS trusts in England for about 9 years. And prior to that, I worked for an overarching Scottish health body called National Services Scotland, and I was with them for 7 years. So the pandemic has really shone a massive spotlight on virtual care in general, and many organisations moved very quickly to adopt new virtual care technologies to try to support the service and to keep patients, the public, and their staff safe. I think that we can all agree that the NHS deserve a massive round of applause for mobilising to the situation so quickly across all facets of healthcare, and they've made a great use of rolling out and adopting both new technologies as well as technologies that have been around for some time, but for various reasons have just not been widely used. So virtual care has encompassed many products, and the ones that I've listed here are the examples that I've seen most commonly considered during the pandemic. So we have remote patient monitoring tools that help clinicians monitor symptoms and activities for patients with a range of conditions. That was very widely rolled out, or is in the process of even still being rolled out to monitor the conditions for COVID patients. But it's been around for some time, particularly for monitoring patients with chronic comorbidities and being able to monitor them from home. I think everyone would agree that virtual consultations or video conferencing has actually exploded in terms of its use throughout the last 12 months with its need to support the pandemic and to allow the health service to continue to operate in some form outside of what was needing to be done to look after COVID patients. Command centers and workflow tools are probably right at the far other side of the spectrum, and it's more blue sky thinking around some of this stuff, but it's definitely a place that a lot of organizations are wanting to get to. And these command center tools are being implemented or are being considered for implementation to automate question and answers and direct patients appropriately, with much less resource required per head of population than some of the other virtual care tools. Today, though, I want to focus a little bit on one of the longest standing virtual care solutions, the patient portal, and how some organisations pulled it out of their back pocket during the pandemic and leveraged this existing, often underused and maybe the slightly poor cousin healthcare IT solution to help reduce service administration time and in-person contact. So in my opinion, the patient portal is something like the jack of all trades in patient engagement technology. It's a tool whose adoption was mandated in some parts of the world, but which has not always had clear use cases. It can have a range of features ready to go out of the box, such as allowing patients to have access to their health records, secure direct messaging, online forms and questionnaires, symptoms tracking, setting goals and actions, sometimes virtual prescription refill requests, and maybe the not so exciting side of pushing out education material to patients. Still very useful, but not so exciting. The problem has been, though, I think, as I said, is that it's just not necessarily been brought on to solve a single significant use case, and so has maybe laboured a little bit in terms of its rollout and adoption. However, when the novel coronavirus forced services across the country to shut their doors to non-emergency and elective care, the kind of functionality listed there became crucial for patients who could not engage with their care providers in person and in the traditional models with which they were used to. So what I wanted to do is, rather than talk to a lot of theory around this and things you already know, I just wanted to run through some examples based on real life use cases across our Ryan Health customers and across other organisations with which I've had dealings. So the first use case is probably not going to be that surprising, and that was around surfacing COVID lab results to patients through the patient portal. Across a number of our customer sites, this was the very first thing that they did. And they either did it through specific data-driven lab views within the product, or by making the lab results available as a letter to the patient that they then pushed to the patient portal and that the patient could access. One customer in Canada reported that this reduced phone calls by up to 60%, freeing up administrative staff. This process of making the COVID-19 results available to patients has made the same customer less nervous about releasing more results to patients, as it has shown them that some of their fear around it generating more work for the teams in terms of questions from patients did not actually come to fruition to the extent with which they were worried about. And with that, the same customer has seen that patients that are getting their results electronically are also more willing to engage with the patient portal regarding the next steps in their care. They are leveraging self-monitoring care plans and using features like Health Library within the patient portal to push out guidance on the quarantine process and long-term care and support after COVID. So the solution is not just about getting a test result anymore. The patient portal is about helping the patient answer, what do I do next? The next use case I want to consider is digital front door. It's another use case which has emerged through the pandemic, and it's an extension of the patient portal from being a check in the box solution for providing access to a patient's health record to becoming the digital front door to help patients get access to appropriate accredited applications and information. The patient portal has been able to adapt to bring together many niche consumer engagement tools and references by leveraging APIs and allowing these tools to plug directly into the patient portal, creating a seamless patient experience. During the pandemic, this was incredibly useful to direct patients who were using to service validated solutions for guidance material and apps, which ensured that they were using the right sources while also saving on administrative time by providing a richer self-service option. It provided a single point of reference for patients, which also mitigated confusion over where to go for the right information. Customers are now thinking beyond just COVID-19 and looking to enhance the patient portal to provide a more user-centric solution across all of their services and specialties. The next use case is the completion of forms and questionnaires. The ability to capture information electronically, particularly via forms and questionnaires, has been a long understood opportunity that the health service has not quite capitalised on fully. And anyone that has known me for a while knows I have been harping on about this one for quite a long time. Patient forms were able to be utilised during COVID to do this for a wide range of things, including capturing the patient's symptoms for COVID-19, through to allowing pre-assessment forms to be completed prior to an appointment or admission, keeping the patient out of a hospital as much as possible, while also saving on administration. One customer in France calculated that across clinics for a single specialty, they were saving approximately 7 minutes on the time in hospital for a patient by distributing and asking the patient to complete electronic forms prior to their hospital visit. The final use case I want to cover off, although there are many more that I could actually talk to, is that more and more we are seeing clinicians want to engage with their patients in a more holistic, complete person way. This was driven in part by value-based healthcare, but also because it is really just a better patient experience and results in improved patient outcomes. And what we are seeing is that patients are wanting to engage more, right? So because they're wanting to engage more, this is also enhancing the amount of patient communication and engagement that's being adopted. In March 2020, when hospitals and clinics were closing their doors to non-urgent care, the patient portal became a place clinicians could go to continue to interact with their patients. The non-urgent care shutdown yielded a spike in patient portal use as clinics and hospitals worked to cancel or reschedule appointments and inform patients. But it also facilitated a bigger shift. Interactions between provider and patients went virtual, and much of it has been driven out of the patient portal. Secure direct messaging, integrated video conferencing, and sharing of files all led the way for providers to keep contact with their patients, both their high-touch chronic care populations and the newly worried well, all from afar. One customer in the UK enhanced their online interaction between clinicians and diabetic patients by using a simple shared files feature that allowed patients with common circulation symptoms such as hair loss on their legs or cracked skin on their feet to take photos or videos and share these via secure shared files with their care team. These files are then available for diabetic team members to access, review, and even set follow-up goals and actions to help improve the patient's circulation, all without the patient needing to have a face-to-face visit. So what next for Patient Portal then? Well, I think the real key is that it will be important for organisations to make the most of this momentum by looking beyond COVID-19 to other services that could benefit from the positive use cases surfaced through a Patient Portal platform for COVID. And I really think that one of the keys to this will be to continue to consider the patient experience and the digital front door use case and providing a single channel for patients and their engagement, and offer that as the single engagement platform for patients. I hope you found this useful. Thank you.